Imagine this. By the time you finish today's to-do list, your heart has quietly worked through thousands of beats under more strain than you think, because of tiny habits that never feel dramatic in the moment. Sitting just a bit longer, pouring a little more sauce, brushing off snoring as just how I am, taking a quick blood pressure reading right after a coffee. None of these seem like headline risks, but stacked together, they nudge your circulation, blood pressure, and vessels in the wrong direction. The World Health Organization reminds us that cardiovascular disease remains the leading global cause of death, which means the basics matter more than ever. So today, I'm exposing 8 everyday mistakes that gradually wear down your heart, and I'll give you simple science-backed fixes you can start this very hour. Everything here is plain English and grounded in real research from trusted organizations and peer-reviewed studies. This video is educational. It does not replace care from your clinician. Let's start with long stretches of sitting. Hours at a desk switch off your leg muscle pumps, slow blood flow, and let glucose and inflammatory markers drift in the wrong direction. Over months and years, that pattern is linked to higher blood pressure, stiffer arteries, and a greater risk of clots. The American Heart Association has consistently cautioned that too much sitting is harmful, even if you exercise later. Movement snacks across the day matter. Your fix: stand up every 30 to 60 minutes, walk while you take calls, do 2 minutes of calf raises or hallway loops, and set a repeating phone reminder so it happens automatically. A common error is believing a single morning workout licenses 10 hours of stillness. It doesn't. Think of movement like hydration, small, frequent sips for your circulation. Speaking of what we sip, many of us pair sitting with highly salted snacks, so let's go there next. Hidden sodium is a stealthy blood pressure driver. Most of the salt you eat doesn't come from the shaker. It's baked into breads, sauces, soups, deli meats, and restaurant meals. According to the CDC, high sodium intake raises blood pressure and increases the risk of heart disease and stroke, and the majority of our intake comes from processed and restaurant foods. That matters because every bump in blood pressure forces your heart to push against a tighter system, gradually stressing the vessel lining. Your fix: become a label detective. Scan for sodium on nutrition facts and favor choices with fewer than about 140 milligrams per serving when you can. Ask for sauces on the side. Replace chips with unsalted nuts or carrot sticks, and season with lemon, garlic, herbs, and pepper blends. Retire this myth. Sea salt is healthier, so I can use more. Your arteries respond to sodium, not to marketing. And while we're in the kitchen, many people swap salt for sweet. So let's tackle added sugar and ultra-processed foods soon. But first, it's time to address the smoke many still think is safer. Tobacco in any form is hostile to your vessels, and vaping isn't a free pass. Combustible cigarettes injure the lining of arteries, oxidize LDL, and raise clot risk. That's well established. But cardiology statements also report that e-cigarettes trigger acute changes in vessel reactivity and nervous system tone, which means the cardiovascular system still takes a hit. Translation: switching from smoking to vaping may lower some toxins, but it does not make your heart safe. The most effective path is quitting with support. Combine behavioral coaching with tools like nicotine replacement or prescription therapies when appropriate. Your clinician can guide the plan. A frequent misstep is attempting a solo cold turkey quit, relapsing after a tough week, then deciding nothing works. Expect multiple attempts and treat each one like a rehearsal that teaches you what to change next time. As you reduce triggers, keep an eye on your sleep, because recovery at night is your heart's reset, and ignoring it is the next mistake. Poor sleep and unaddressed snoring or apnea quietly strain the heart. Short, irregular, or fragmented sleep keeps stress hormones elevated, nudges blood pressure upward, and steers appetite toward high-sugar, high-salt foods. If obstructive sleep apnea is present, loud snoring, witnessed pauses in breathing, morning headaches, or daytime sleepiness, Your oxygen levels can dip repeatedly, forcing your heart and vessels to ride a nightly roller coaster. Mayo Clinic and other centers emphasize that treating sleep apnea improves symptoms and is associated with better cardiovascular outcomes over time. Your fix: protect a consistent sleep window, same bed and wake times, keep the room dark and cool, and give yourself a 60-minute wind down without bright screens. If the red flags are there, ask your doctor about a sleep assessment. The mistake to avoid is normalizing epic snoring as a personality quirk. Snoring is a clue. It deserves curiosity, not pride. And while we're talking numbers like blood pressure at night, let's make sure we measure that number right when we're awake. Inaccurate blood pressure checks mislead millions. Taking a reading with your legs crossed, a cuff over clothing, or right after coffee or a brisk walk can give you false spikes. Using a wrist gadget that hasn't been validated or taking one hurried reading and declaring victory or disaster is another trap. The American Heart Association's home monitoring guidance is straightforward. Avoid caffeine, exercise, and smoking for 30 minutes beforehand. Empty your bladder, sit with back supported and feet flat for 5 minutes. Rest your arm at heart level. Use a validated upper arm cuff that fits, and take 2 readings 1 minute apart in the morning and again in the evening for several days. Then average them. Your fix: write down date and time plus both readings for 7 days and bring the average to your clinician. The common error is making big decisions from one stressed commute reading. Averages reveal the truth. One-off spikes only shout. Now, even perfect readings won't protect you if your food pattern quietly fuels triglycerides and belly fat. So let's straighten that out. Too much added sugar and ultra-processed food quietly sabotages heart health. Large population studies have linked higher added sugar intake with increased cardiovascular mortality over time. One well-known analysis in JAMA Internal Medicine reported that people who obtained a large share of calories from added sugar had a higher risk of dying from heart disease. Separately, research in the BMJ has associated diets heavy in ultra-processed foods, packaged snacks, sugary cereals, processed meats, instant noodles, with more cardiovascular events. No single treat defines your destiny. Patterns do. Your fix is to elevate the base of most meals. Colorful vegetables and fruits, beans and lentils, nuts and seeds, fish or lean proteins, whole grains, olive oil and water, or unsweetened tea. Swap sugary drinks for sparkling water with citrus. Try oats with berries instead of sweet cereal. Keep a handful of unsalted nuts in your bag for the 4 p.m. crash. And choose plain yogurt with fruit over desserts with long ingredient lists. The trap to avoid is letting low-fat labels distract you from sugar and sodium on the same package. Read the whole story. Your arteries do. Another mistake that flies under the radar: stopping or skipping heart and blood pressure medications when you feel fine or after a good lab result. Hypertension and cholesterol problems are often silent, which is exactly why consistent therapy matters. Studies repeatedly show that better adherence is associated with fewer events. Poor adherence predicts trouble ahead. If side effects or costs are a barrier, that is a conversation, not a reason to vanish your pills. Your fix: make taking medicine friction-free and visible. Use a weekly pill box. Pair doses with habits you never skip: brushing teeth, morning coffee. Set phone alarms and ask your clinician about 90-day refills to reduce pharmacy trips. If a statin causes muscle aches, speak up. Dosing time, type, or amount can often be adjusted. The error to avoid is stopping right after numbers improve, forgetting that the medication helped create that improvement. Keep the gains you've earned. But consistency also applies to emotional hygiene. Your heart doesn't just respond to nutrients and numbers, it responds to your daily stress load. Chronic stress without daily recovery keeps your cardiovascular system on a hair trigger. Stress hormones tighten vessels, elevate blood pressure, and tilt habits toward less sleep and more ultra-processed comfort food. Harvard Health often highlights how ongoing stress lowers the threshold for heart problems and fuels low-grade inflammation. The solution is not to eliminate stress. It's to install reliable recovery anchors. Your fix: schedule micro breaks you can keep on your worst day. A 5-minute breathing reset after lunch, a 10-minute walk before dinner, 2 minutes of box breathing in the bathroom before a difficult meeting, or writing down one thing you're grateful for before bed. Regular, moderate physical activity is a potent stress reliever, and brief nature exposures, sunlight on your face, looking at trees, noticing birds, help your nervous system shift gears. The mistake to avoid is saving all relief for weekends or vacations. A heart prefers small daily decompressions over rare, heroic escapes. Before we recap, there's one more invisible stressor many people underestimate, so let's circle back to food with a twist you can apply tonight. Portion creep at restaurants and healthy-ish packaged foods can cancel your best intentions. A bowl labeled grain and greens that's drenched in salty dressing and topped with processed plant-based add-ons may deliver more sodium and added sugar than a burger. Restaurant portions have grown over time, and sauces often hide both salt and sugar. Your fix: portion with your eyes before you dig in. Mentally divide the plate and box half to go if the serving is huge. Ask for dressings on the side and use a fork dip rather than a pour. Choose dishes where you can see the ingredients: grilled fish, beans, vegetables, olive oil, lemon, rather than mystery mix sauces. At home, pre-plate rather than eating from the bag, and try a smaller dinner plate to make quality portions look generous. The error to avoid is assuming organic, natural, or plant-based automatically means heart smart. Labels are not outcomes, ingredients and totals are. Let's turn all of this into a quick plan you can feel this week. For 7 days, track 3 things without judgment. 1. How often you interrupt sitting, a tick mark every time you stand at least 2 minutes. 2. Your sodium exposure. Write down the highest sodium item you ate that day and what you swapped the next day. And 3. 2 morning and 2 evening blood pressure readings taken correctly, averaged at the end of the week. Choose one today change that fits your real life. Maybe a repeating 45-minute stand and stretch alarm, swapping your usual lunch chips for an apple and a handful of unsalted nuts, or a 20-minute after-dinner walk with your phone on airplane mode. Put health on the calendar. If your 7-day home BP average lands at or above 130/80, if snoring with pauses, morning headaches, or daytime sleepiness sound familiar, or if quitting tobacco has stalled, book a check-in with your clinician and bring your notes. Quick recap so it sticks. Break up long sitting with movement snacks. Hunt hidden sodium in packaged and restaurant foods. Don't assume vaping is harmless. Get real support to quit. Protect a consistent sleep window and screen for apnea when the clues are there. Measure blood pressure the right way and average several days. Build most meals from minimally processed ingredients and keep added sugar low. Take prescribed heart and blood pressure medications consistently and problem-solve side effects rather than ghosting your plan. Install daily stress recovery anchors you can keep on your busiest day. And right-size portions, especially when sauces and health-washed labels try to fool you. None of this asks you to be perfect. It asks you to be consistent, because consistency is how hearts heal and how time with the people you love stretches longer. If this helped, comment with the one change you'll start today. Share this with someone 50+ who might normalize loud snoring or just a little high blood pressure, and subscribe for upcoming videos. Midweek, we'll dive into heart-smart foods you can actually enjoy. And this weekend, we'll cover simple strength moves for bones and muscles that protect your independence. This content uses plain language and real, verifiable sources, but it's not a diagnosis or treatment plan. Please talk with your clinician before changing medications or making major adjustments, and seek care promptly for concerning symptoms.